Is my screen visible now? Am I audible? So see, the erythroblast. Am I audible? Is my screen visible now? Just give me one moment to check the internet connectivity. It is getting delayed. Is my voice clear now? Okay. So see, all the cells emerge from your stem cells. Okay. So your bone marrow has the stem cells which can convert into a mature RBC. Okay, it can convert into a red blood cells. But there is an entire process of maturation that has to take place within the bone marrow. Only then RBCs can be released from your bone marrow into the blood circulation. Okay, so in the process of maturation, you can see here from the erythroblast. Okay, this is the proerythroblast. Again, immature, it has to convert into it has to enter into the phase 1, where your RNA synthesis of your RBCs will begin. And in these phases where erythroblast means immature RBC. Okay, so the immature RBCs, to undergo maturation, it requires iron, it requires vitamin B6, copper. Okay, these elements are required for the maturation of erythroblast. Okay, and then the heme group, that is the iron containing group, a protein and an iron containing group, they will come together in this maturation phase and they form hemoglobin. Okay, globin is the protein, heme is the iron containing part. Okay, they come together and they form hemoglobin, and that hemoglobin accumulation also takes place in this maturation phase. Okay, and during the maturation phase, you can see here nucleus is present. This violet color you see, purple violet color, that is the nucleation, and the nucleus will be dropped off. Your RBCs will not have nucleus. Okay, RBCs is a cell, but it does not have nucleus. The white blood cells, they have nucleus, but red blood cells, they do not have nucleus. And after getting, after the nucleus is deposited off, it is in the form of reticulocyte. This, you can see here, I'm marking the arrow. This is the reticulocyte. And in this form, reticulocytes, they get released into the bloodstream. Okay, and after 24 hours or 36 hours, reticulocytes will become into a mature erythrocyte. Erythrocyte means RBC, red blood cell. Okay, Cyte means cell. Erythro means red. So red blood cell. So that is erythrocyte. So this is the formation of red blood cells. Is it clear to all? So the body has a mechanism. Our body knows that iron is a very difficult mineral to be absorbed and all. Okay, so what the body has a mechanism of scavenging. Scavenging means making sure the body does not lose any more iron. Okay, so all the RBC, the mature RBC you see here, the red color one, erythrocyte, it has a life cycle of 120 days. Okay, when it gets worn out, it goes into the spleen. The spleen will make sure all the heme part, that is the iron containing part, is saved. And the remaining part of the remaining body of the RBC will be discarded. Okay. Next is the absorption part. Absorption and metabolism. So absorption is done by your intestine. Okay, whatever you eat, the food, okay, it gets into your body in an inactive form. Okay, you can see here Fe plus plus plus. So it comes in a ferrous form. So it has to get into your intestine. Okay, and here it loses its iron. Okay, and it forms into a ferritin form, because here ferritin is a protein. Okay, only with the help of this protein, the iron that your intestine has just now absorbed can move along the intestine and get an exit through the intestine into the bloodstream. Okay, and that also with the help of ferroportin. Ferroportin is another protein which will make sure that the iron molecules that ferritin is bringing is transferred into the bloodstream. Okay, and again in the bloodstream you can see another protein, transferrin. You know the function of transferrin, I have explained it. Transferrin is another protein that helps the ferrous molecules to move from point A to point B. The active form of the ferrous form of iron cannot be moved. They cannot move in the blood circulation. Okay, they have to be bound to a protein called transferrin. Only with this binding they can move through the blood circulation. Okay, and then they will get deposited wherever iron stores are required. Okay, wherever the functions of iron is required, they can go and get deposited there. Okay. And even in the spleen, you can see spleen also have ferritin, okay, to store iron. Okay, if your spleen has ferritin to store iron, your liver also has ferritin to store iron. Okay, so if this ferritin is a protein that will help to hold on to iron and keep it there, and whenever it is required, it will be released. Okay, so this is the absorption of iron. Just understand this absorption. These are the proteins required for the proper absorption and movement of iron within the body. Okay. So you eat your food, vegetarian or non-vegetarian. Ferrous form of iron is found in the food, but the ferrous form of iron cannot move in your organs. Your organs have a protein called ferritin, which helps in taking the iron molecules, okay, binding itself to the iron molecules and moving the iron molecules around from point A to point B. Because we can see here, this, can you visualize finger-like projections? So from this finger-like projections, iron is getting absorbed. Okay, from here to the distal end. Okay, this is the distal end. Okay, to the proximal end, iron has to move. From this distance to this distance, iron has to move, because so the blood circulation will connect from this part, the down part of the enterocyte layer. Okay, so the movement of iron from point A to point B, ferritin is required. Okay, and after here, from here, when it has to enter into the blood circulation, ferroportin is required. And once it is in the blood circulation, transferrin is required. Okay, so they are like playing, passing the ball. Okay, your ball is the iron, and the people who are passing the ball are ferritin, ferroportin, and transferrin. Okay, is it clear now? And next, the metabolism. How do you get rid of the iron? How does iron leave your body? Okay. So through your feces, that is passing the stool, your bowel movements, okay, through feces, around 11 microgram of iron is lost. Okay. Menstrual loss in women, okay, 28 microgram every month. 28 microgram of iron is lost, average approximately. Disquamation means at night, during the winter seasons. Okay, during winter seasons, you will witness this dry skin, dry, flaky skin. Okay, if you scratch it, the dry skin, you will see it flying into the air. Okay, it's very light. It's the flakes of skin. Okay, the white flaky skin that will just shed off your skin. It's very common during winter season. Okay, so that's just an example of desquamation. Desquamation usually takes place throughout the year. Okay, every day some part of your old cell will just get desquamated. Okay, the old skin is getting replaced by new skin in different part of your body at different intervals of time. But that is also called desquamation. But the rate of desquamation is higher during winter seasons. Okay, that's the reason why you get dry skin. It's not faces, it is feces. Okay, like it's your stool, your bowel movement. Okay. Fecal loss of iron depends on your intake of iron. Because remember, I mentioned iron is a very difficult um, mineral to be absorbed. So, for example, if you are having a bowl full of an iron-rich source, okay, just imagine you are having a rich iron-rich food source. It has around 100 microgram of iron, but those 100 microgram of iron will not be absorbed. Okay, only hardly 10% of that will be absorbed. The remaining will be let out of your intestine as it is. Okay, so that is the fecal loss of iron. It completely depends. If you are not eating iron-rich food, 11 mg might not be the loss that you will have on a daily basis. It completely depends on what is your iron intake on a daily basis. If you have high iron intake, higher will be the loss. If you have low iron intake, lower will be the loss. Okay, because it's a difficult mineral to be absorbed. Hardly 3 to 10% of iron will be absorbed only if the given conditions are conducive for iron absorption. Only then it will be absorbed, otherwise not. Is it clear? 11 mg is just an average, depending also considering the rate of anemia that we have in India, considering that as well. 11 mg is just an average. Next is iron balance. So we have lot many way to lose iron from our body. Okay, there are many ways. Iron absorption is first of all difficult, but on top of that, there are many ways in which we can lose iron. Okay, even if you meet with an accident or so, there is an internal bleeding or external bleeding, you are losing iron. Okay, bleeding also, hemorrhage or bleeding leads to loss of iron as well. Okay, so there are lot many ways in which iron can be lost. So the body has its own mechanism to safeguard, to prevent excessive loss of iron. Okay, the body knows that iron loss routes are higher. Okay, so how to scavenge or save the iron that we already have within the body? Okay, so first form is the reutilization from catabolized red cells, that as I mentioned earlier, red blood cells that are old, that get worn out, they enter the spleen. Okay, the spleen will pick the heme part. Okay, the globin part, protein part will be discarded. Okay, heme part, the iron part will be kept back in the spleen. So that is catabolization. Okay, red blood cells, catabolization means what? Breakdown. Catabolized red blood cells means broken down red blood cells. Okay, from there, iron will be reutilized. Iron will be saved. It will be stored in the spleen. Whenever there is the iron store depletion going on, the iron stored in the spleen will be ejected into the bloodstream and it will be reutilized. Is it clear? Next is upper limit cessation in absorption, which means you are having iron rich diet on a daily basis. On top of that, you are having iron supplements as well. Okay. So there is too much of iron that is entering your body, but there is an upper limit in absorption. Your intestines also know when we have to stop absorbing. There is too much of input of iron. We have to stop the absorption of iron. Okay, so that is upper limit cessation. It works in the other way as well. Okay, when there is too low, when you're anemic, when you're suffering from anemia, when the iron stores within the body is dropping down. Okay, at that time also your intestine will know this, that the body is getting depleted out of iron. We have to absorb as much as iron possible from the diet. It works both the way. There is a lower limit and an upper limit. Your intestine functions accordingly. Okay, depending on your dietary intake. Yeah, if you have your iron in, like you are not anemic, your body has enough amount of iron. Okay, your intestine will not bother absorbing more and more iron. Okay, until and unless you reach a level of toxicity. Iron toxicity can also happen. Next is ferritin. So ferritin, as I mentioned, it is a protein. Am I audible now? Am I audible to all? Okay. Ferritin, as I mentioned, it's a protein. Ferritin is a protein. It is the storage protein. Transferrin is the transport protein. Ferritin is the storage protein. So wherever, in whichever organs of your body ferritin is present, it means those organs are your iron stores. Okay. In your intestine, ferritin is present, in your liver and in your spleen. Okay. In kidneys also, ferritin is present. Okay. Less amount of ferritin is present in the kidneys as well. So wherever ferritin is present, it acts as an iron store. Okay. For future, whenever the iron is getting depleted or your diet has changed, now you are not getting enough iron, you have ferritin stores. Okay. That will give you the that will reciprocate accordingly to fulfill the iron requirements. Okay. Especially during pregnancy and all, last trimester of pregnancy, when the iron requirement is excessive, okay, these ferritin will be required to store and release the iron accordingly. So iron balance, is it clear to all? Next is the different types of iron. Okay, heme iron and non-heme iron. Okay, heme iron is the natural form of iron. Okay, non-heme iron is kind of a synthesized form, but it can be still absorbed from your body. So heme iron is more bioavailable, which means the natural form of iron which can be easily absorbed in your intestine. Okay, and then the non-heme iron, they come in various form. Okay, ferrous fumarate, ferrous sulfate. So these are the supplements. Usually they are found in supplements. Okay, non-heme iron is found in supplements. And the heme iron is easy on stomach. When you eat any iron rich food, okay, you don't have any symptoms. But when you have iron supplements, usually there are certain side effects associated, specifically if you are using old generation iron supplements like ferrous sulfate. Okay, they come with certain side effects like constipation, dark colored stool and all. Okay, you can take the heme based supplements with or without food, and non-heme based supplements you cannot take on empty stomach. Okay, and it is the heme based iron is not affected by stomach acid, but the non-heme iron, it requires vitamin C, antacid. And if you are on antacids, okay, if you have acidity issues, you're taking acidity medication, which will make your stomach less acidic. And if your stomach is less acidic, it will not, the supplements will not be absorbed properly. It requires vitamin C as well for absorption. But heme iron, it does not require too much of complications for absorption. Okay. It can be found in natural, non-genetically modified organism. GMO means genetically modified organism. It includes plant as well. Okay. Plants are also nowadays, the plants, agricultural food are slightly genetically modified so that it can fulfill the increasing demands of the population explosion that we have worldwide. Okay, so the cereals, the grains, the legumes, the pulses, everything that you eat agriculturally, whatever is produced right now, more or less it is genetically modified. Okay, so that you get more of the food and nutrient. Okay, and the genetically modified organisms, they tend to have less seeds and all. Okay, that's less way to proliferate it more. It is found in synthetic iron salt because it is artificially produced. Absorption is inhibited by calcium. If it is more than 300 microgram of serving of calcium is there in the same meal. Okay, please remember this. Having calcium and iron together is fine until and unless the calcium amount, the quantity of calcium in your meal, if it is more than 300 mg, only then it will suppress iron absorption. If the calcium content in your meal that you're having, if it is less than 300 mg, it will not have any effect on iron absorption. Iron will also be absorbed, calcium will also be absorbed. But if the calcium content is too high, then iron will not be absorbed. Okay, so that's the reason why calcium supplements and iron supplements should not be taken together. Okay, because usually your calcium supplements are above 300 mg. Okay. People who have calcium stones, a low calcium diet is recommended. Okay. So those who have calcium stones, if you are following a low calcium diet, it will not affect your iron absorption at all. But naturally speaking, for example, palak paneer, okay, palak paneer is a good source of protein. It is a good source of iron. It is also a good source of calcium. But the calcium is found in paneer as well. Calcium is found in palak as well. Okay, but the amount of calcium found in the recipe of palak paneer per serving, okay, it is not more than 300 mg. Okay, the calcium found in palak paneer is not more than 300 mg. So it will not affect your iron absorption. Spinach also has iron. Okay, so in palak paneer, when you have palak paneer, it will not inhibit calcium, will not inhibit iron absorption. Iron will not inhibit calcium absorption. They both will be absorbed properly. But when you are using non-heme iron, okay, when you are using non-heme iron, there are lot many elements that can block the absorption of non-heme iron sources: calcium, milk, coffee, caffeine, any wine, chocolate, cheese, okay, any oxalate or phytate rich food, yogurts, seeds, beans, okay. And if you're on antacids, okay, there are many other elements that you have to look out for if the supplement is a non-heme supplement. Okay, heme iron, usually from all your non-vegetarian sources, you usually get heme iron. Next is enhanced absorption factors. How can you enhance the iron absorption within your body? First, increasing acidity. How can you increase the acidic environment of your gut? Take more citrus fruit, okay? Take more organic food which has vitamin C, citric acid, lactic acid, tartaric acid, okay? Hydrochloric acid. These are the different forms of acids found in food that can increase the acidity in your gut, okay? And that can absorb the iron more. Animal tissue protein, okay, milk or dairy products are not tissue protein, okay, those are milk protein. Tissue protein is like the meaty part of non-vegetarian diet, okay. Usually if you are having iron supplements on empty stomach with a glass of orange juice or lemon juice, it's better. And after 1 hour or after 2 hours, you can have your tea, coffee, eggs, okay, or any dairy product. If the calcium in your meal is more than 300 mg, heme absorption will be inhibited. So when you have tissue protein, animal tissue protein like meat, poultry, fish, okay, they have this protein called cysteine. Okay, that's an amino acid called cysteine that will increase the absorption of iron. Then your body's requirement, as I mentioned, if your body's iron stores are getting depleted, if you are going low and low in iron stores, slowly your body will know to absorb more iron. Okay, so naturally your intestine will start absorbing more iron. Once the body knows that the iron stores are getting depleted, it will start absorbing more iron. Then the presence of lactoferrin and lactalbumin. Okay, so this is found in breast milk. So in breast milk, lactoferrin and lactalbumin is found, but in very low quantity. And the presence of these protein, lactoferrin and lactalbumin, that enhances the iron absorption. In human milk, albumin is more in number. In cow's milk, lactoferrin is more in number. Okay, so both of these proteins help in the absorption of iron. So continuing the breastfeeding even after 6 months of age and still feeding the child with iron-rich food, it will ensure that the iron is getting absorbed in the weaning diet. In calcium, adequate amount of calcium can help in iron absorption because, as I mentioned, when the calcium level in your meal is less than 300 microgram, okay, these calciums can go and bind itself to phytates and oxalates and phosphates. These are also other elements, phytates, oxalates, phosphates. These are also other anti-nutrients that will not allow iron absorption. Okay, so calcium will take care of these phosphates, oxalates, and phytates, and iron on the very same time can be easily absorbed by the intestine. Okay. So the enhancing factors, is it clear to all? Remember, calcium less than 300 mg, less than 300 microgram of calcium in your meal, not the entire day's diet. Remember this, in the meal that you're eating, either breakfast, lunch, or dinner. Okay. If your calcium intake in that particular meal is less than 300 mg, it will not affect iron absorption, but it can enhance iron absorption because calcium will go and interact with oxalates, phytates, phosphates. Oxalates, phytates, phosphates are anti-nutrients. Okay, the presence of these oxalates, phytates, phosphates will resist the absorption of other nutrients, not just iron. Okay, not just iron, it can inhibit the absorption of other nutrients as well. So the presence of calcium, what it can do? Calcium can go and bind with oxalates and it will form calcium oxalate. It can go and bind with phosphate and form calcium phosphate, and it can get out of your body as it is through your feces. Okay, because it becomes a precipitate, it cannot be digested or absorbed, so it has to leave your body as it is. So it is calcium less than 300 microgram is kind of creating a pathway, okay, for the easy absorption of iron. But remember, less than 300 mg. Is it clear to all? Next is inhibiting absorption. Inhibiting absorption means how iron absorption can go wrong. Okay, what are the resisting factors in iron absorption? First is low gastric acidity, which means if you are taking antacids, okay, you have gas acidity issues, you drink that pink colored bottle, okay, or you take any antacids like eno, okay, these are alkaline in nature, okay, so high amounts of sodium bicarbonate in your diet, Okay, soda bicarbonate in your baking soda, everything, these are more in your diet. Okay, it makes your gut more alkaline in nature. So in alkaline environment, iron absorption is reduced. Okay, so if you don't have enough gastric acid secretion going on, it may affect iron absorption negatively. Next is increased gastric motility. So with what does your gastric motility increase? Having what? Too much of what? Yes, too much of fiber. Okay. Too much of fiber will lead to increased gastric motility. Okay. So not just iron absorption, but all the other nutrient absorption can also get affected. Not just iron. Okay. Any other mineral or vitamin absorption will be reduced because the intestine does not have enough time to catch all the nutrients. Okay. Because of increased gastric motility, the food chyme is just moving past through your intestine without giving enough time for absorption. Then phytates and oxalates. So as I mentioned, not just iron absorption, they inhibit a lot of mineral and vitamin absorption as well because they are called anti-nutrients. Okay, phytates, oxalates, saponins. Okay, there are a list of antioxidants, anti-nutrients that will not allow the absorption of useful nutrients. Okay. Gastric motility means your movement of food within your intestine. You have fiber-rich food. The movement of the food within your intestine is so fast that there is no time for your intestine to absorb nutrients. And phytates and oxalates, as I mentioned, if you are having fermented food, okay, fermentation, any food that undergoes fermentation, automatically the phytate level and oxalate level reduces. Okay, if you are soaking your legumes, pulses, and lentils, okay, before cooking them properly, at least for if you overnight, if you are soaking your chana dal, rajma, and all, okay, at least for half an hour or 1 hour, if you are soaking the lentils. Okay, the aim of soaking is to get rid of as much as phytates and oxalates as possible. Okay, and also to speed up the cooking process. Okay, so soaking the legumes, pulses is very helpful to get rid of phytates and oxalates. Fermentation, any food that can undergo fermentation, vegetables and fruits, they also have phytates and oxalates. Okay, if you are having pickled vegetables, okay, fermented pickled vegetables and all, automatically the process of fermentation will degrade the phytate and oxalate, so it will not affect the absorption. Okay, so removing phytates and oxalates is important. Polyphenols. So these are organic compounds present in coffee, tea, chocolate, okay, and some vegetables as well. And they are able to reduce the absorption of iron from the meal as much as by 70%. Okay, so that could also lead to iron deficiency. Too much of polyphenols in your diet, having too much of tea, too much of coffee, in short, too much of chocolate intake. Okay, in some cultures, even while having lunch, while having dinner, a glass of hot tea they will have soon after having lunch or dinner or before it. Okay, these kind of habits can also prevent iron absorption. Okay. Then minerals, the presence of cobalt, zinc, too much of calcium, too much of copper. Okay, they have a competition with iron in absorption. Okay. Manganese, because they all share the same absorption pathway. So all of these minerals are in a competition with each other that who will get absorbed first. So if the diet has high amount of zinc, high amount of copper, cobalt, these trace minerals, they will interact with the pathways and it will not allow iron to be absorbed. The only practical solution in this kind of situation is because all your food some or the other way will have all these minerals. Okay, the only solution that you have is to increase the intake of iron. Your iron intake has to be more, because iron, as you have seen, has a lot of inhibiting factors that will not allow iron absorption. The only solution to all this is take more iron in your diet, have more iron rich food. Okay, because you can't uh, pick which food is free of cobalt, which food is free of copper, because your body requires copper, your body requires zinc. Okay, all these minerals are important for your body. Okay, you can't be picky with the minerals. You have to have all these mineral rich food. Okay, the only solution here is to add more iron based supplements or iron based food in your diet. Then infection, if the body is fighting through severe infection or the body has been exposed to recurrent infection, that also inhibits iron absorption. Then having non-tissue proteins like that, like milk, cheese, egg. Okay, these are not tissue protein. Tissue protein means what? Meat, fish. Okay, any flesh of the non-vegetarian food sources, fleshy part, that's a tissue protein. Okay, non-tissue protein is like milk. Milk is not a tissue. So all the dairy product, okay, dairy products are not tissue protein. Eggs do not have tissue. Egg is just a cell. Okay, so it's not a tissue. So egg is not a tissue protein. So all the inhibiting factors of absorption, is it clear to all? Next is toxicity. Toxicity of iron or overload of iron. What happens? Okay, so hemochromatosis, it's a liver condition. You can see here a comparison of healthy liver and a hemochromatosis liver, because as we know, liver stores iron. Okay, liver has this protein ferrin, that will store iron. Too much of iron absorbed in times of toxicity, like cooking and keeping the food in cast iron vessels, okay, on a daily basis, that could lead to iron toxicity. Okay, too much of iron supplements could lead to iron toxicity over a period of time. Excess of calcium will decrease iron absorption. So in these kind of toxicity levels, when the liver is overloaded with ferrous molecules, okay, it will lead to inflammation. Liver cells which are storing iron will undergo inflammation, irritation. The liver will undergo enlargement, hepatomegaly, enlarged liver. Okay, so that is hemochromatosis. If it is not treated quickly, it could lead to cirrhosis of liver as well. It could lead to death as well. Cirrhosis of liver means scarring of liver. Healthy liver tissues will undergo scar formation. Okay. It has symptoms. Okay, all the symptoms of liver conditions will be there. You will suffer from jaundice. There will be distension of your peritoneum, distended abdomen. Okay, bile will be, your digestion and metabolism will be affected because liver is underperforming. Okay, pain, tenderness and pain, malaise, high fever, because it's inflammation. So high fever will be there. Jaundice will definitely be there. All the symptoms of hepatomegaly, liver cirrhosis will be found here as well. If the iron content of the body is not reduced, it could lead to cirrhosis and it can lead to death as well. So that is hemochromatosis. And then other symptom is the eye of a person who has hemochromatosis will have a rusty appearance. You know the color of rust, okay? A rusted iron metal, what would be the color of rust? Okay, so a very similar color of the eye is seen. Okay, and usually people who work in mining, people who work in the mining industry, especially iron mines and all, iron ore dust, because if they are not wearing their personal protective equipment, the iron dust, they are inhaling iron dust. Okay, so that could also lead to iron toxicity. So RDA, please refer the table 12.3 on page number 234. Pregnant and lactating women is important. Rich sources of iron, garden cress seeds, curry leaves, mint leaves, coriander leaves, dark green leafy vegetables, amaranth leaves. Okay. Iron from animal sources are absorbed better than plant-based sources that we have discussed already. Dates, okay, but you can't consume too much of dates because it will increase your blood sugar levels. So pulses are also a good source of iron if you are cooking it properly, soaking the legumes and pulses properly, and then consuming it, that would be better. Liver, ragi, all your cereals, okay, they have iron to some degree, but if cooked properly, combination should be better. Green leafy vegetables. 3 to 4 dates on a daily basis is fine. 3 to 4 dates, not more than that. In plant-based food, garden cress seeds has the highest amount of iron content. In non-vegetarian food, liver, any liver, okay, has a high amount of iron content. You can switch dates with raisins. Raisins can be a better alternative for dates. Way to tackle anemia. Symptoms usually are liver-based symptoms. Polyuria is not always a symptom with iron toxicity. Okay. Depending on what phase of iron toxicity you are, it depends. But iron toxicity is very rare until and unless you are working in such conditions or you are overdosing yourself with iron supplements. Iron toxicity is very rare. So iron deficiency is very common. Okay, lack of iron is more common than toxicity. And nutritional anemia, iron deficiency anemia, just because of not having enough iron or folic acid in your diet, that leads to anemia, that is nutritional anemia. Okay. So first, your food lacks iron, your blood loss, heavy menstrual bleeding and all. Women who have heavy bleeding on a monthly basis, they suffer from anemia. Worm infections in children. Okay, it's very common in children getting intestinal infections. So they also suffer from anemia. If you suffer from kidney diseases, hypothyroidism, any metabolic diseases, endocrine abnormalities, okay, or body is unable to absorb iron for any medical reasons, too much of stress, okay. These are the causes of anemia usually. In detail about anemia, we will discuss in nutritional anemia chapter, and also in Wednesday classes, we'll discuss anemia in detail, different types of anemia. So we'll see that during those chapters. Treatment of anemia, first is having a balanced diet, including vegetables who are rich in iron, okay. At least 50 grams of green leafy vegetables should be there in your diet on a daily basis. Okay, the carrots, radish, beetroots, tomatoes, potatoes, green leafy vegetables, fruits like bananas, apples, pomegranate, sapota, that is chiku. Okay, iron supplements should be taken only under medical advice. Nutraceuticals you can still take if you know that your diet does not have the above on a daily basis. If you're not having all these which is mentioned here, nutraceuticals, iron supplements in the form of nutraceuticals you can take, okay. But the iron supplements in the prescription form only through medical advice you have to take, okay. Spinach with egg and along with tomatoes. Egg, spinach, and tomatoes. Making an omelette of egg, spinach, and tomatoes is a really good, healthy option. Having a tomato spinach sandwich with some cheese, okay, that's also a really good option. In severe cases of anemia, blood transfusion will be required. Symptoms of anemia: weakness, fatigue, shortness of breath, getting tired immediately after a small physical activity, giddiness, that is, you're sitting for a long time, you stand up immediately and you feel that head rush, okay? Very common in girls and women. Increased heartbeat, heart palpitations, feeling anxiety always, dry skin, irritation in mood. How can you diagnose anemia? Go for blood test always. Even if you can do the eye test, okay? Checking the under eye, okay? Checking the color of your nail bed, okay? So that will not give you an accurate result, but it will give you an idea that you may be suffering from anemia. Getting a blood work done is always constructive, okay? It's the best way to diagnose in which stage of anemia you are. And okay, just by looking at the conjunctiva at the bottom of your eyelid, okay, that will not give you a correct idea of which phase of anemia you are in. Do a blood test, see your transferrin level, ferritin levels, okay, hemoglobin levels. That will give you a better insight of what level of anemia, what stage of anemia you're suffering from. Causes of iron deficiency, major causes, just we had discussed here, increased needs, but you're not fulfilling it, like during growth spurt in teenage, too much of menstrual heavy flow, pregnancy, lactation, during cancer, okay? Need is high, but you're not able to fulfill it with your diet. Not taking enough amount of diet, okay? Having a vegan diet or having a very limited diet, like I will only have liquid diet for 10 days, okay? Like that, when you put yourself through a crash diet and all, okay? If you suffer from malnutrition, yes, a person with normal hemoglobin level will still be iron deficient because hemoglobin will go down, hemoglobin levels will fall only in the third stage of anemia. In the first two stages, when the iron stores are getting depleted, your hemoglobin level can still be normal and you will still be anemic. Okay. Decreased absorption, if you have too much of gas, like alkaline gut, okay, not enough acidic gut. If you have undergone any bariatric surgery, that is stapling the stomach, okay, for weight loss, vitamin C deficiency. So clinical findings of iron deficiency anemia: getting frequent infection, that is immunocompetence, okay, getting frequent infections, not able to resist infections, not able to work properly, do not have enough focus in your work, lack of cognitive development, okay, your motor skills in children, okay, under the age of 10, cognitive development will be affected. And if the child is suffering from severe anemia from a long period of time, it could also lead to mental retardation, okay, because the brain cells may not get oxygenation, enough oxygenation for a long period of time. It could lead to mental retardation. Behavioral implication, that is triggered child, okay, always hyperactive, okay, getting irritated fast, irrational behavior in class. Structure and function of skin epithelial cell, tissues change. For example, koilonychia, spoon-shaped the nails. Okay, skin becomes very pale, dry. Okay, so this is the diagnosis when you do a blood test. Okay, this if the levels of ferritin, ferritin, serum iron, serum transferrin, if it goes down, okay, if it is decreased, it goes down this normal range, it means you are anemic. Treatment: oral administration of ferrous sulfate, 50 to 20, 200 mg, depending on what age group you are. Okay. What physiology, phase of physiology you are in. Pregnant women will have a separate, different kind of iron intake as compared to lactating women. Teenage girls will have a different dose. Children will have different dose. Okay. So based on your age group, dose is recommended. Specific doses are recommended. Neonates or young toddlers also, they also have a different dosage of ferrous sulfate, but the range is somewhere between 50 to 200 mg. So that range is decided by the clinician, doctors. Okay. Prevention: increase the awareness of anemia. Okay. Dietary improvement has to be done. Proper diet can definitely prevent anemia. Add more, if you are a non-vegetarian, add more tissue protein in your diet, add more organ protein in your diet. Okay. If you're a vegetarian or vegan, make sure on a daily basis, green leafy vegetables, seeds, nuts, dry fruits rich in iron is also a part of your diet. Okay. Supplementation, as I mentioned earlier, ferrous sulfate and folic acid supplementation is given for pregnant women, lactating women, adolescent girls, and school-going children. And this is free of cost, okay? Usually in the government schools, public schools, the supplementations are given on a regular basis. In private schools, it's not that common. From the PHC, by primary healthcare centers or community healthcare center, or from any government hospitals, pregnant women and lactating women can get free supplementation of iron tablets and folic acid tablets. Then you have food fortification, which means like adding the nutrition, adding the iron in a limited dose, but in such a way that it does not lead to toxicity, but it can cover majority of the population. So the food that you select is very important. For example, salt. Salt is used by everyone, vegetarians, non-vegetarians, vegans, whatever is your diet. Okay. Every religion, every ethnicity, everyone takes salt. So if you fortify salt, the iron is reaching everywhere. So use double fortified salt, okay, which has iodine and iron as well. That is so use a double fortified salt which has both iron and iodine. Okay. Pink salt, if it is fortified with iron and iodine, it is good. If it is not fortified with iron and iodine, I would not recommend that. Okay. Because if you are having pink salt or any form of salt, okay, it may have some certain minerals, but it does not, but your salt intake is so limited, okay? Hardly 1 spoon of salt or half a spoon of salt is what everyone has on a daily basis, okay? And the majority, 95% of half a spoon of salt, okay, 95 to 97% of that half a spoon of salt, if you, let it be pink salt or any form of salt, it is sodium chloride, okay? And 3% or 4% of half a spoon of salt may be having other minerals, okay? That too, it does not have iodine and iron, okay? That too, it may have other minerals, but it does not have the key minerals, iodine and iron, which is fortified, okay? So there is no use of taking pink salt. If pink salt is fortified with iron and iodine, then it is fine, okay? But if it is not fortified, if you're taking pink salt for other minerals that you get hardly 3 or 4% from half a spoon, spoon salt, okay, which will not at all benefit you, okay? In no way it is negligible. And when it enters the body, there is sweat loss, there is fecal loss, considering all the digestive losses. Hardly, it's a very negligible amount of minerals from pink salt that may be entering your body system. So there is no way of spending that extra money in a pink salt. That it's better to take a normal double fortified salt, okay? That will at least prevent any nutritional anemia, and it can also prevent iron deficiency disorders. Is it clear to all? So this is an image of the Tata double fortified salt, iron and iodine fortified salt. It comes in red package. Next is education. You can use Anganwadi centers, ASHA workers, community health workers, community medicine doctors or nurses to impart this education among the masses, because they have a better reach into the rural areas as well, to give the importance of how iron or iodine is important in the diet. Antenatal clinics are a very good places, and also family planning centers, okay? Women who are planning to get pregnant, before they start before they start conceiving, they should correct their iron deficiency and iodine deficiency.